Thank you. On behalf of our team, it's a great privilege to accept this award. As pharmacists, it's our job to make sure our medications are used safely, not only for every patient we care for individually, but also on a broader scale. Thank you to Cardinal Health and to the ASHP Foundation for your support in this mission. To the ASHP reviewers and the video crew, we appreciate your sincere interest in our work. The pill service, despite being a small program at one VA in one corner of the country, is really part of a bigger picture. The VA network extends from the foundation of national VA leaders all the way to frontline staff. First, we want to acknowledge our senior leaders, notably Dr. Jane, Chief of Patient Care Services. You heard from him in the video. This program would not exist without the VA Central Office of Geriatrics and Extended Care. They provided our startup funding through their transformational care grants. Dr. Maureen Layden, who's with us tonight, she leads the charge for medication reconciliation across the country for all VAs with endless enthusiasm. Sam Narayana, our regional pharmacy executive, is here with us tonight as well. We want to thank him. From VA Boston, our medical center director, Mr. Lawson, and chief of staff, Dr. Tarnas, have shown ongoing support of clinical pharmacy initiatives. Our local pharmacy leaders, Bill Flanagan, Bob Hinault, we thank them for giving us the flexibility to put our ideas into practice. And to John Rafaro, who encouraged us to apply for this award 2 years in a row. The pill service in what you saw in that video is truly reflective of a team effort. I am incredibly grateful to my colleagues. They have been instrumental at every stage, but most importantly, they've taken great care of our patients. Pharmacist Marcy Sallow, she led the original pill clinic innovation, and it was from Marcy that I first learned about the complexities of medications in older patients. Her mentorship and insights have been invaluable. Many thanks to Dr. Jim Rudolph. It is motivating to work with a provider who values the work of pharmacists. Every day I see patients in clinic with Dr. Rudolph or other geriatricians, and I learn something that can make me a better pharmacist. Our nurse practitioner, Mary Beth Harrington, has been critical to the expansion of our pill clinic. To update you on some of these numbers, we've now reached over 600 patients. Also, our social worker, Liz Archambault, and research assistant, Brittany Kelly, have been key to keeping this program up and running. As highlighted by ASHP Foundation, and as you see in these videos and with the finalists here tonight, medication safety is a team effort. From a medication reconciliation standpoint, we believe patients need to be part of that collaboration. That being said, we do want to acknowledge our patients and thank them, as well as their caregivers, for working with us over the past couple of years. It is an honor and a privilege to work with veterans, and we thank you for this award and this recognition.
I am just humbled to be here tonight. I don't know if you realize how big of an honor this is for a geriatrician. If you look at the medical specialties pyramid, geriatrician's right at the very bottom. We don't have a procedure, we don't have a medical device, we tend to lose money. But being at the bottom of the pyramid gives us some real advantages over other specialties. First, geriatricians share a passion for taking care of older patients. And this condition is infectious, and that's really that infectious, contagious, just concern for older patients is really what drove the initial innovation of pill and the expansion of pill that we've seen. The second and probably the most important point is geriatricians are trained to work in teams. And pill is a collaboration among pharmacy, geriatrics, but nursing, social work, primary care, other medical specialties, all of us working together. It's a really important part of it. Geriatricians tend to be natural educators. Right now there are fewer than 8,000 geriatricians in this country with a growing older population. We have no choice but to teach. And that is the undocumented outcome in the video, is the unparalleled educational experience that we're able to give to future generations of pharmacists and physicians, working together to take care of older patients. Finally, as a geriatrician, I'm grateful every day. So many people and patients are responsible for why we're here tonight. I'm thankful to my family. I'm thankful to our pill team. I'm thankful to the VA Boston healthcare system. I'm thankful to the GREC, to the Office of Geriatrics and Extended Care, and the Office of Pharmacy Benefits Management. All of these people all of these groups have come together to support us along the way. Mostly though, I'm thankful to our veterans. The VA was born on a promise made by Abraham Lincoln in his second inaugural address: to care for him who shall have borne the battle, his widow, his orphan. Every day we get to work with our nation's heroes, and it's a very humbling experience. So, on behalf of this humble geriatrician, our pill team, the VA Boston healthcare system, and the overall Veterans Health Administration, thank you to the ASHP Foundation, the Cardinal Health Foundation, for having the vision to support and encourage innovations in care for older patients. Thank you.